Hey everyone, and welcome to this explainer. Today we're diving into a public health crisis that affects millions of lives, yet honestly it has been dangerously misunderstood for generations. We're going to look straight at the actual science of the human brain to completely shatter a stigma that's been hanging around for a century. By the end of this explainer, you are going to see addiction through a totally new, scientifically grounded lens. Let's get into it. So, let's kick things off with a pretty provocative question. Is addiction simply a lack of willpower? Now, for decades, society basically answered that with a resounding yes. It's a harsh question, I know, but we really have to ask it to highlight just how dangerously society misunderstood this condition for a very, very long time. It was a misconception that literally shaped our entire cultural and legal response to drug use. To put this into perspective, back in the 1930s, scientists and society alike actually thought people with an addiction were simply morally flawed. They genuinely believed it was a failure of character, which led to an overwhelming emphasis on punishment. But today, well, thanks to some incredible leaps in research, our modern scientific view recognizes addiction for what it truly is, a medical disorder that involves physical brain changes. We've shifted our massive paradigm away from punishment, focusing instead on prevention and treatment. Section 1. The Brain Science Revolution. The crucial point is defined perfectly by the National Institute on Drug Abuse. Addiction is a medical disorder that affects the brain and changes behavior. It is absolutely not a choice. It's a physical alteration of the brain's circuitry. When we talk about how addiction changes human brains, we're talking about tangible, structural, and chemical modifications that foster compulsive drug use. Understanding this basic biological rewiring is the foundational reason why quitting is so incredibly difficult, and it's the key to entirely reshaping how we treat the individuals suffering from it. Now, these physical alterations in the brainstem stem from a complex, interconnected web of risk factors. We've got biological factors, environmental triggers like your surroundings or intense stress, and genetic variations. What's absolutely captivating about the current state of this science is that while we know these factors exist, we are still actively searching for the exact genetic links that contribute to the development and progression of the disorder. The puzzle isn't fully solved just yet, but we finally have the right pieces on the table to understand how the brain becomes vulnerable. Section 2. The Scope of the Crisis. I want you to let this staggering number sink in for a second. 27 million. According to the Department of Health and Human Services, that is the number of people in the United States who recently reported illicit drug use or prescription drug misuse. We're not just talking about some theoretical medical issue here. We are talking about 27 million individuals dealing with physically altered brain chemistry. This is a massive public health challenge affecting our friends, our neighbors, and our families. And this crisis doesn't just stop at illicit or prescription drugs either. Nearly a quarter of adults and adolescents reported binge drinking in the past month. Almost a quarter. Alcohol acts on the brain in ways that can also lead to the severe medical disorder of addiction, cementing this as a widespread, society-wide issue that touches pretty much every demographic. Section 3. The Cost and the Gap. The sheer financial reality of this crisis is staggering. The annual economic impact sits at $249 billion lost to alcohol misuse and another $193 billion lost to illicit drug use. We are talking about hundreds of billions of dollars draining our economy every single year. It's exactly why the Surgeon General has made mitigating this epidemic a major priority, actively championing efforts to leverage public health, business, and law enforcement resources to address this head-on. Within this wider epidemic, we face a very specific, terrifying crisis: opioid misuse, which includes prescription pain relievers, heroin, and synthetic opioids like fentanyl, is now officially recognized as a common chronic illness. By accurately framing it as a chronic illness rooted in the brain's altered chemistry, health officials are emphasizing that it requires ongoing, specialized medical management, just like heart disease or asthma would. But here is where the story gets incredibly tragic. 1 in 4. Despite the fact that we have highly effective treatments available for opioid use disorder, only about 1 in 4 people with this disorder actually receive any type of specialty care. Think about that. The gap between the medical science we have and the people who desperately need it is a massive chasm that we absolutely have to close. Section 4. A Science-Based Future. So what does this all mean for us? Here is our actionable path forward to heal communities and brains alike, broken down into 3 steps. Step 1. We have to empower individuals to make informed choices through real education. Step 2. Our communities must adopt science-based prevention policies, finally stepping away from those 1930s punishment models. And Step 3. We must drastically improve and expand our treatment approaches. This structured path proves that when we treat addiction as a physical health problem rather than a moral failing, we actually can reduce the terrible toll it takes on everyone. As Dr. Nora D. Volkow, the director of the National Institute on Drug Abuse, states, increased understanding of the basics of addiction will empower people to make informed choices and adopt science-based policies. That quote just brilliantly solidifies our core message today. Knowledge is power. A true scientific understanding of how the brain changes is the ultimate tool we have to foster compassion and create effective change. Let's leave off with a thought-provoking question. Knowing that addiction is a medical disorder that physically alters the brain, how can society better support those who desperately need treatment? Think about your own community. How can we shatter the remaining stigmas? How can we advocate for that science-based future? The answers to these questions literally have the power to save lives. Thank you so much for joining me to explore this fascinating and crucial topic. Keep learning, keep asking questions, and I'll catch you in the next explainer.